So what is regenerative medicine? Again, it's a field that really deals with regenerating or replacing or repairing normal tissue and normal function. It includes a whole variety of different possibilities, as simple as, microscopic changes, but also macroscopic changes. In fact, already, we can grow organs in laboratories with stem cells. Now, we're not really, that obviously hasn't been deployed into the general medical world, and there's some, political and ethical questions surrounding that, even if it's coming from the patient's own body. We won't get into that political debate today, but we have the technology to be able to do this already. And regenerative medicine involves stem cells as well as growth factors, so it's not just all about stem cells. So when we look at the healing environment, we talked about inflammation, we talked about how it's important to make sure that inflammation resolves so you can get better. How do we do that? Well, our traditional techniques include anti-inflammatories, non-steroidal anti-inflammatories, or even steroid medication, oral as well as injectable to try to reduce inflammation. It can include things like hyaluronic acid. You may have heard of various products under that category. For example, when knees are painful, they put various hyaluronic acid, or some people call it rooster comb products, into the knees to help the joints have a little more cushion with this sort of jelly-like substance. PRP, or platelet-rich plasma, which has been around for about 20 years or so, looking at growth factors that's already existing in your own blood. Amniotic fluid liquid suspension, which we'll talk about more, and amniotic fluid in general, as well as amniotic membrane and umbilical cord, we'll talk about in more detail. And then finally, Wharton jelly liquid suspension, which contains some non-autologous stem cells, so we'll talk about that as well. When we look at cellular products, or products that we can harvest that have specific cells, one of the products is a lipoaspirate, which is when you literally do a liposuction on a patient, and you harvest the cells, you spin them down, you take out all the fat, you take out all the other byproducts, and you have just pure stem cells. And those are autologous stem cells. That means those are stem cells coming from your own body. Bone marrow aspirate concentration, where you suck out the bone marrow, again, spinning that down to pure stem cells, again, stem cells that are coming from your own body. And then umbilical cord blood, so the blood from the umbilical cord contains stem cells that can be spun down into more pure stem cells, although we'll talk about that in detail. And then finally, umbilical cord mesenchymal stem cells. So PRP is something that's been around for a little while. Have you guys all heard of PRP, or who has or has not? Who has heard of PRP? And who has not heard of PRP? Okay, so probably about a 2/3, 1/3 mix. So PRP was sort of the original, regenerative medicine techniques or options that we had. It's platelet-rich plasma, which is defined as autologous blood with concentrations of platelets above baseline, and that contains at least 7 growth factors. Okay, so the way that PRP is harvested and the way that it's administered is relatively simple. So what happens is you draw blood from the patient. That blood is then spun down into different components, as you can see right here on the bottom here. It's kind of spun down, so you take the red blood cells out, you have the platelets and the white blood cells, and then you have the plasma. So when you spin that down, you're going to end up with various growth factors, and that's really what you're trying to achieve in this process. It's been used since 1987, so it's been used for quite a while, about 30 years now. And so it's kind of the old technology, if you will. Still works, but there are better options out there. There are other options out there. So some of the advantages are that it's coming from your own body. Okay, so it's not coming from somewhere else. It's relatively cheap. It's not too expensive to, if you have all the equipment and everything, it's not too expensive to be able to, get PRP. And usually it's not too expensive for the patient. Obviously, everything's relative, as you know, in the medical world. Unfortunately, everything ends up being expensive just because the overhead that's involved. And it can be reproducible geographically. So, anyone anywhere can draw blood, and if you have the right centrifuge and you have the right equipment to spin down the blood, that can really be done almost anywhere. But some of the disadvantages, and now that we have better technologies, we can really start harping on the disadvantages because some of the newer technologies don't have these disadvantages. You do see some inflammation with PRP, which some would argue is what you're looking for. You're trying to get an inflammatory response so you can have the body sort of repair itself. But that inflammatory response in some patients can be really unpleasant, and it may actually just sort of, almost prevent what we're trying to achieve here. You can have unwanted products in the cells. So things like white blood cells and other inflammatory agents can be in the PRP. And that's a problem, We're trying to reduce inflammation and reduce pain, and we're not trying to create more problems. So that can happen. PRP is also drawn from the patient's blood if there's any infections in there, viruses, bacteria, whatever. This is not sterilized, so you may be reintroducing those, those bad cells into the patient again. And then finally, there's still a lot of questions that exist in the sense of, okay, what's the right amount of PRP? How many cells do we really need? What's more effective? What's less effective? So a lot of questions still haven't been answered when it comes to PRP. So, but that's been, PRP again, been around for about 30 years. For about 20 of those years, that was really the go-to agent when we're looking at regenerative medicine. Now we have a whole list of other options, and some of those options include stem cells.